Well, good afternoon. Thank you for joining our telephone town hall, which is titled COVID-19 and Seniors, How to Protect Your Elderly Loved Ones. This is Congressman Scott Perry conducting the teletown hall, and we're going to be joined by some guests, but I just want to kind of set up the conversation a little bit by talking about where we are right now. As you know, the outbreak of COVID-19, which is also known as coronavirus, is a public health threat to our communities and the people in them, of course. And as of yesterday, the PA Department of Health announced that there are 96 confirmed cases of COVID-19 in Pennsylvania, including 2 in York County and 10 in Cumberland County. Now, that probably was updated out even as of this morning, but that's as of yesterday. Nationwide, according to the CDC, the Center for Disease Control, there were 4,226 cases with 75 confirmed deaths. Our federal, state, and local officials are working hard to respond to the outbreak of COVID-19 in our communities, and everyone has a role to play to slow down the spread of this virus. And we're hosting the call today to talk about the threat of COVID-19 to our older adults and steps that we can all take, whether we ourselves are at higher risk or our family member, or we are taking care of someone who is at higher risk of complications from the virus. Now, according to the CDC, the Center for Disease Control and Prevention, individuals considered to be at higher risk of getting very sick from this illness include the following: older adults and people who have serious chronic medical conditions, including heart disease, diabetes, and lung disease. Now, I'm joined today by Dr. David Gasparek, who is the Vice President and Regional Medical Director at WellSpan Medical Group. And I want to thank Dr. Gasparek and WellSpan for their leadership and for all the great work they do in the community, and for attending today and being on the call to answer any one of your questions. We're also joined by Lisa Torchia, the Vice President of Clinical and Support Services at Country Meadows Retirement Communities. And we have Lisa here, and we also thank her as a leader. Their company are leaders in elder care and retirement communities. They do an absolutely wonderful job if you've ever visited one of their facilities. And of course, they have very specific requirements, including those that were handed down by the federal government, and she will explain them, so we're all very understanding of the circumstances that they are operating in. Again, thanks to Dr. Gasparek and Lisa for joining the call today. I'm honored to have you leading experts from our community brief us and answer the questions that people may have. Now, before I kick it over to them for their briefings, I want to give you a rundown of the actions the federal government has taken to protect the health and safety of our country, and to stay up to date on information and guidance related to COVID-19, which quite honestly is changing almost daily. So this is a good point to make. The federal government has launched coronavirus.gov to keep the public informed. And if you do have questions, that's a good place to start and just to check on a regular basis. Now, 2 weeks ago, Congress passed and the President signed legislation providing $8.3 billion for the COVID-19 response. You might wonder what the money went for. It went for test distribution, vaccine development, and sending resources to state and local officials to make sure that we were prepared for the virus and what might occur from a hospitalization standpoint to just a public health awareness standpoint, everything in between. And last week, President Trump declared a national emergency, and what that did was allow the states and territories and tribes to access over, I think, $42 billion in existing funding through a thing called the Stafford Act, which is used for disasters. Additionally, last week, the House of Representatives passed a $53 billion package that provides free tests to all Americans and will provide aid to small businesses, employees, and families that are most affected by the outbreak of COVID-19. Now, the Centers for Medicare and Medicaid Services, that's CMS, has continuously issued guidance and measures to protect nursing home residents from COVID-19 based on that CDC guidance. Earlier today, I saw the Pennsylvania Department of Aging released additional COVID-19 guidance to area agencies on aging, those are at your county level, and adult day center providers to address their operational needs during the outbreak of COVID-19. Now, we're going to go into more detail, I'm sure, on the guidance coming from CMS and the Pennsylvania Department of Aging during this call. With that, what I'd like to do is kick it off to Lisa from the Country Meadows Retirement Communities for her portion of the briefing. Lisa?
All right. Thank you, Congressman Perry, and thanks for having me here today. Coronavirus and COVID-19. Coronavirus is the name of that big grouping of coronaviruses, of which all of us have probably had one in the past. If we've had a common cold, there's a good chance it may have been a coronavirus for us. But it's in the family of coronavirus. The new strain that came out this year has been named COVID-19, and that strain was never transmitted to humans before. So it is something that we don't have any antibodies build up against that, and we don't have immunizations for that. So that is why it's such a concern. It's a very highly contagious bug for us, so that virus is highly contagious, so we need to be careful about that. And how does that virus spread? It spreads mainly from person to person, mainly between people who are close contact with one another, and those respiratory droplets that people produce when they cough or sneeze, or sometimes even if they're talking. So you want to stay, pretty far away from people. They're recommending up to 6 feet away. And those droplets, they land on the noses or mouth of people nearby, or if you touch something, a surface that maybe those have landed on and the virus is sitting on, that can be spread by you touching your nose or your mouth or your eyes. So you can inoculate yourself almost with the virus by touching. And because it's so highly contagious and we don't really have any immunities against that, we want to be very careful ourselves, and that's why in senior living we are so sensitive to that. The symptoms of coronavirus, the COVID-19 coronavirus, is the major symptoms are fever, cough, and some shortness of breath, difficulty breathing, sore throat, aches, much like influenza, and those symptoms may be mild in most everyone, but they can be very, very severe in some. And as you heard Congressman Perry say, is that the severity in our elderly is what's of grave concern for us. They have a mortality rate that is much higher than others who would have that disease. I think it had been like up to between 14 and 17% for those over 80 years old has been early reported in that. And I think as we have more testing, we'll be able to really hone in on that and see if that number is actually where it's going to be, because our denominator will be bigger, that we'll be able to assess better, what is that actual mortality. But we do know this, in that those who have been infected, the elderly and those with chronic diseases or are immunocompromised, have much more severity of illness than those who are younger. So what's the treatment for COVID-19? Pretty much there's not any treatment other than handling the symptoms of it. It's prompt recognition of those symptoms to be able to support those residents. And there's no vaccine, although they're working on it, and it's several months away. I think there's some early breakthroughs. They're feeling positive that they'll have something, but it still is a few months away. And antiviral medications is under some experimental testing. Like when we have the flu, we might take Tamiflu, but they've had tried some of those without much effectiveness, but they are still experimenting with some that look promising. So, we're all in this together. It's hard to know what's ahead, but as a community for senior living and for our residents and in the healthcare community, we're really focused on what we can do to try to prevent that transmission. Right now, aggressive prevention is the most important focus that we have. As we start to see more cases in Pennsylvania, we'll be handling the management of those cases and those who are ill. But preventing is really what we're trying to do right now while we're off, hunkered down, staying home, not going places that are out there. So generally, here are many of the things that the facilities out there are doing. One, and most important thing for everyone, is frequent, I call it hand hygiene, frequent either washing your hands or sanitizing your hands with alcohol-based rub that is at least 60% alcohol. Those are most important things because that's how lots of viruses and bacteria get transmitted to us. And again, that's how you inoculate yourself, is by touching your mouth, your nose, your eyes, open areas with those hands that have touched the surface that has the virus on it. So probably you're hearing about restricted visitation at many of our facilities, and it's been evolving. There are changes every single day on how we're handling things in senior living and elder care. We have great communication, I have to say, with we have conference calls. We have daily, sometimes 2 and 3 conference calls a day with the CDC, our Pennsylvania Department of Health, the Pennsylvania Healthcare Coalition, CMS themselves, for us, the American Healthcare Association, and the Pennsylvania Healthcare Association, and Argentum are some of the many who, and PALA, Pennsylvania Assisted Living Association. They're all working together to try to make sure that everyone has the information that they need to look at what we need to do next. We have guidelines that come to us from those organizations. Sometimes CDC especially will send out guidelines, but then we also have, federal government guidelines. Our president has guided us in some of the things that we need to do. We also have states. Many of the governors are implementing things in individual states on what we need to do. We're all similar in what we're doing, but some are slightly different. So one of the things, first of all, we all posted signs at our doors and limited entrances to the buildings to try to funnel all of the visitors in one area when we were having visitation, so that they would be screened on coming in, to be screened to make sure they haven't traveled to those level 2 or 3 areas, and that they haven't been exposed to somebody with COVID-19 or having symptoms themselves. So that much of that screening does involve temperature taking to assure that they don't have a fever that they don't realize while they were coming in. Pretty much visitation now is restricted in most areas and required, I think, for us to be restricting that visitation to protect our seniors. And, it's only in rare cases. At very end of life, maybe if families come in as long as they can meet screening criteria to come in. So that restricted visitation is one of the most important things, because we're trying to do that aggressive prevention, and that preventing is preventing person-to-person contact, and that's going to be what does it for us. What the communities are doing is they're providing a lot of, I know we are, alternative activities, because our group activities are suspended. We've been either by regulatory or by organizations themselves looking at what's the safest thing to do is to keep our residents even away from each other in the communities. So we need to find alternative things that they can do, word games, brain games. We're at our facility implementing some live video activities that can be accessed through TV for our residents, because we're trying to keep them in small groups and not those large groups that we did before. So we also have, one of the most important things we did early on is we assured that the cleaning products that we use were effective against the virus. So we really followed guidance that came out from our federal government to say these are those hospital-grade cleaning agents that are best to be used in our organizations. And luckily, we had the ones in place that were at the ready, because we're always worried about influenza and anything else that can be transmitted. So we're very careful about what we use, and we were pleased that they were on that list indeed for us. Another thing we do is communicate to families. We send some direct communication to families, and we also have a website where they can come and where we update it, because daily things are changing in all of our communities and communities across Pennsylvania regarding how we handle the virus, what are the steps that we're taking to prevent residents, and the things that they can do also. So staying in communication with them is very important, because they're concerned and worried about their loved one, and we want to assure that we're doing everything we can to protect them, but also to give them a wonderful quality of life while we're going through this difficult experience for us. So, and all facilities have pandemic policies in place, task forces. We have a task force here that meets every day. Then we also communicate with our campuses every day from our home office with things we've learned, situations that have come up, how we handle them, what we need to do. So we have that daily communication. Training our staff members to assist on the campuses that are maybe at our home or corporate offices. So we have some extra hands in the event that our workforce isn't as strong as it can be, that maybe some of those people need to be staying home because they're on a restriction for 14 days of a quarantine. Okay. And you probably know that there are dining restrictions in many, many places about communal dining, and many places going to residents dining in their room. So they are isolated out there, and we need to think about how we stay in communication with them, and I'll talk about a little bit about that shortly. So we're doing a lot as organizations, and we also have our professional groups that we talk to. So we talk with our colleagues about what else they're doing. We're all helping each other in this situation to try to do the best we can for our residents, because their health and well-being is our #1 priority. So generally, what can you do for yourself, first of all, and those are the things that our residents also need to be thinking about, and then we'll talk about how you can help them. For yourself, again, most important thing you can do is frequent hand washing or hand sanitizing. If you're washing your hands, make sure you're washing them thoroughly for 20 seconds, in and out of your fingers, up top of each hand, and the palms, your fingers, fingernails. Make sure you get all of those areas, because the virus can live in all those little crevices. But good 20 seconds, you can sing songs. People are singing happy birthday a couple of times, or the alphabet a couple of times, to make sure that they're washing their hands thoroughly enough for a long time. Or if you're sanitizing with alcohol-based rub, you want to, if you have a pump, great, pump it right into your hand. If you have one of those handheld ones, I want to tell you one of the best things to do. That handheld one, or the one that you hold in your pocket, a small alcohol rub, you want to take that out, pop the lid open, squeeze it into your hand. Before you clean your hands, don't put that down. Hold that and close the lid of your hand gel. Put it back in your pocket. Then the gel that's in your other hand, rub all over it, clean your hands, because you don't want your clean hands to touch the dirty container that you just took out of your pocket to recontaminate your hands. So be careful of that with their alcohol-based hand rub. And either of them, hand washing or sanitizing with the alcohol-based hand rub, are effective in working against the virus. And hand washing is recommended if your hands are visibly soiled or dirty. But otherwise, hand washing or sanitizing, both equally effective for that. Okay, next thing is clean your surfaces frequently. And this virus can live on surfaces anywhere from 2 to 3 hours to a couple of days for some surfaces. And these different surfaces are different amounts of time. So I'd say be cautious about cleaning your surfaces frequently, so you don't have that virus sitting there waiting for you to touch it. Social distancing. I think that's a new term now that we're all using in our country, and it really means staying in, avoiding crowds, and when you are with others, try to stay 3 or really 6 feet, preferably away from each other. No hugs or handshakes, so you can wave, you can nod, you can bow to people. I do an air high five sometimes at them, but we don't want to be touching people right now. And again, I think this will be temporary. These are our measures now to prevent aggressively that spread of the virus. The next thing, do not touch your face. That face, especially your nose, mouth, and eyes, called the T-zone. That's really where you're going to be inoculating yourself with the virus. So stay away from touching your face. And that's not an easy thing to do. You don't realize how much it touches your face. What we've done here is that we try to police each other if we see someone going for their face. Or, you know what, we've even seen people that are turning the pages of a book and they want to lick their finger and turn the page. People don't even realize they do it sometimes. So we've caught people and tried to say, don't do that to protect yourself. So we're trying to be helpful to each other. Okay. Next is just be alert for any signs and symptoms that you or anyone else may have. And if so, you need to seek medical attention. But that seeking really means making the call first to your primary care physician, your provider, or if you're going to an urgent care center or an ER, please call them first so they know you're coming, because they want to be protecting other people who are there for other reasons from any transmission of this virus to them. So if you have those signs and symptoms, call first. Many times you might be handled and screened over the telephone, and they might have you go for some testing. And now, luckily, the federal government has opened up telehealth for physicians to be able to have telehealth visits. So they could, if you have an iPad, they could do FaceTime with you as a visit in that way even for us. So call for medical attention early on if you see signs and symptoms. One of the other most important things is cover your cough or your sneeze. You know, they call that cough and sneeze etiquette. You want to cover your cough or your sneeze, and not in your hands, but you want to use your elbow. Is the recommended way that if you're sneezing, sneeze into your elbow, if you can do so. And if you have tissues also that if you've used, don't use them again and again. You know, don't tuck them up your sleeve or in your pocket. Throw them away right away. Get a fresh tissue next time that you need it. So make sure that that tissue is not around or causing virus to sit on another surface. So that's a lot for what all of us can do. What can we do to support our senior family members to help them, because they're isolated, they may have anxiety because they're alone, they're hearing information, they watch the news also like all of us, so they worry a lot. One of the most important things that I can tell you to do is do not visit them. You need to stay away. We don't want to inadvertently transmit that virus to them by visiting. We might have been exposed and not even known it. People are telling you that if you're in the supermarket and you're feeling a head of lettuce in those plastic bags, you need to wash your hands after that, or after you're touching things in the supermarket, because other people have all touched them and you don't know how long it's been, or if they've been exposed, or if they are active with that virus. And they're out there.
So Lisa, that's an important point. It's not that you don't want family members to come visit their loved ones in your facilities. It's just that two things. One, it's essentially could be unhealthy, right? They could be unwittingly transferring the sickness, but also you've been given directives from both the federal and the state government. Is that right?
That's correct.
Yeah.
Yes, and
All
this
right.
is really for their protection, and we love our residents, and we feel for them that their families aren't there, and some families are staying in contact with them in many ways, and our coworkers are willing to help them. The use of FaceTime or Zoom, methods that they can at least see their face while they're talking to them. But even just phone calls will make a difference, and you might want to increase those phone calls right now because they're isolated. They may be frightened and worried about things. Know that. Go ahead.
That's a great point, and you just don't want folks that are in facilities and isolated even more so than maybe they normally are to feel like they've been abandoned. And it's a great point to make for the greater community. Lisa, can we just hold off at this point for questions and ask Dr. Gasparic, who's the Vice President and Regional Medical Director for WellSpan Medical Group, to kind of give his briefing? I know that WellSpan is a valued treasure and a leader in community wellness and care that we've all respected and many come to depend upon. Dr. Gasparic, can you kind of give us your thoughts for 8 to 10 minutes here?
Sure. Good afternoon, everyone. This is Dr. Dave Gasparic, Vice President and Regional Medical Director with WellSpan Medical Group. First of all, thank you, Congressman Perry, for the opportunity to participate today. We appreciate your support of the emergency funding legislation that was recently signed into law. WellSpan Health has been in regular contact with all of our federal, state, and local elected officials and appreciate their support. We've also been actively collaborating with our partners in healthcare, other health systems, social service, and emergency response sectors throughout York County and the other regions that we serve. Today, we are one community with one goal, working together to care for our friends and neighbors during this uncertain time. For WellSpan Health, our teams are working tirelessly around the clock to ensure we are a prepared and trusted partner for our communities. As the Congressman mentioned earlier, PA Department of Health has announced 2 positive cases in York County. WellSpan is prepared and has developed a comprehensive response to this issue, including an active testing program that is now underway. So we have deployed the use of open-air screening and testing tents at each of our 6 acute care hospitals. So if you show up to one of our emergency rooms, like at York Hospital, you will see a tent out front that if you present with symptoms that are suspect for COVID-19, you will be evaluated, screened, and tested in the tent rather than being brought into the building. Doing that screening and testing in the open-air environment limits the potential spread of the disease, and it helps us to preserve the negative airflow rooms that are in our hospitals. In addition, we've begun to implement similar outdoor testing locations at non-hospital sites across the service area. In York County, we have a tent set up at our Cape Horn location in Red Lion, and that site is specifically for testing for the COVID-19 virus. In terms of recommendations, we're encouraging all patients, if you suspect that you have symptoms related to the coronavirus, which are fever and cough or shortness of breath, please call your healthcare provider first so that we can direct you to the appropriate care setting to get the treatment that you need. Instinctually, when we don't feel well, we either want to go to our PCP or go to urgent care or go to the emergency room. That's really not the appropriate thing to do at this time. Please pick up the phone and call first so that we can triage you to the place you need to receive care. A lot of things Lisa already mentioned. Remember, the best way to prevent from getting sick is to wash your hands frequently, avoid touching your face, and avoid contact with people who are sick. Cover your mouth and nose with a tissue when you sneeze or cough. And like Lisa mentioned, cleaning services frequently, including countertops, light switches, cell phones, and other frequently touched items. Most importantly, if you yourself are sick, please try and stay home and avoid contact with others. The main takeaway, other than if you're sick, call your healthcare provider first, the main takeaway is to try and social distance yourself, try to self-isolate as much as possible. And this pertains also to entering healthcare facilities, having appointments with your doctor. I had hours in my office this morning, and I looked at my schedule, and anyone that was over 60, I called them early this morning and said, rather than coming in and potentially exposing you, why don't we do this over the phone? And I reviewed their medications, reviewed their lab work, addressed any concerns they had over the phone. The patient got the care that they needed, but we didn't need to bring them in and potentially expose them to the virus. So we're encouraging our seniors to do that. We'll see a lot more of that rolling out in the days to weeks coming. More visits by phone, more visits by video. WellSpan has a very interactive portal that patients can use to communicate with their providers. So a lot of new kinds of visits that we're doing. Patients are also welcome to visit wellspan.org/coronavirus, where they can also use an automated chat feature. So they can put in their symptoms with the chat bot, and it'll help us determine whether or not they could be at risk for coronavirus. Both the proactive measures we're taking as well as these steps we're asking the community to take can help us to slow the spread of coronavirus. You've probably heard flatten the curve. That is slowing the spread, flattening the curve of its progression to allow us to care for our patients in the very best way possible. As always, WellSpan Health is committed to providing trusted information to our patients and providing exceptional care for all who live in our communities. And with that, I'll turn it back to you, Congressman.
Well, thank you so much, Dr. Gasparek. Folks, if you do have a question while Lisa and Dr. Gasparek are on the phone, or me, of course, dial *3 for questions. I do have a couple questions to get started. Dr. Gasparek, if I know you kind of went through the testing protocol, and we appreciate the details. Essentially, what it sounds like is that for people that feel like they're showing symptoms, that's how they would come in. Of course, contact ahead of time, and the reason for the outside or the drive-up testing, if you will. Can you speak to the difference between the flu, the regular flu that folks might contract, and this from the time where you start exhibiting symptoms to or the time you catch it to the time you exhibit symptoms? I understand it's appreciably longer for the coronavirus. So the point is that people might not be exhibiting symptoms while they might be contagious. Is that correct?
That is correct. The time from exposure to development of symptoms is longer with the coronavirus than it is for flu. So one of the recommendations that we have is, if you have been exposed to a confirmed case of the coronavirus, we're encouraging you to stay home. So testing, so actually doing a swab, is not recommended until you develop symptoms, because that onset to symptoms is so long. So if you came in contact with someone today, a giant that is confirmed positive with coronavirus, if we test you today, your test might come back negative. We would ask you to go home and wait a week, and during that week, if you develop symptoms, then we would test you. So it's that latent period where you do not have symptoms after exposure, but you are still contagious at that time, that we would ask you all to stay home, not run out and try and get tested.
Okay, thanks. That's a great clarification. Now, Doc, as you know, and again, dial *3. We're going to go to your questions here shortly. I just want to get the queue filled up there. The federal government has provided the funding and the mechanisms for anybody that wants to be tested, but I think what you're urging right now is that to make sure, or to encourage people to wait to be tested until they have symptoms. I suspect from any of the healthcare systems, there's a downside to folks showing up when they don't have symptoms, but asking for a test just to check it out, or just if they're curious or what have you. Can you kind of speak to that?
Well, the fear is that if you come in too early for testing and you test negative, you're going to have a false sense of reassurance that you don't have the virus, and then you wouldn't limit yourself the way you would otherwise. You might be around family, you might be around some of the seniors in your community, and you're exposing them to the virus at that point. So it's not that we don't want to test you. This is about a public health initiative. We're trying to keep as many people safe as possible. So if you've been exposed to a confirmed case, please stay home until you develop symptoms.
Yeah, and I'm sure it's hard for people to kind of hear that and think about that, but you can tell by the good doctor's definition and explanation there why it's important to follow the doctor's and the practitioner's orders at this point. All right, let's see if we have some questions. Again, dial *3 if you have questions. Do we have any questions for Lisa, Dr. Gasparic, or myself?
Yes, we do. Our first question is from William Walker.
Are you on the phone there, William?
Yes, I am. Sorry, I didn't know that's how this worked. My question was
ahead.
about social distancing. Is gardening in the backyard an acceptable thing if it's a suburban type of backyard with, 100 feet or 50 feet from our neighbors?
Dr. Gasparic, I feel like these are technical questions. I think I know the answer, but if you could answer that for William, that'd be great.
Yeah, when we talk about social distancing, Lisa mentioned it a couple times. It's the 6 feet. You might even see if you come to one of our practices when we're screening you, we're going to stand approximately 6 feet away from you. That's the CDC recommendation to prevent the spread of droplets from one person to another.
Okay.
And if you're talking about gardening in your own personal backyard, absolutely. There's no one else in your backyard. There's no way that would have been infected by the droplets.
Right.
That's safe.
Walks in the neighborhood as well if you maintain the 6 feet distance?
Keep your distance and wash your hands when you get home.
Okay. Thank you so much. Really do appreciate this.
Yep.
Thank you, William. Again, dial *3 if you have questions. Do we have another question on the line, please?
Yes, we do. Our next question comes from Miss Rose Sipe.
Rose, if you're on the phone, go ahead.
I had a question. You're talking about temperature. What do you consider a temperature? Do you want for an elderly person? Are you saying if I feel bad and I get sick, I should call my family doctor when over 100 or 101, or what are you talking about?
Hi, Rose. By definition, our temperature is 100.4. Now, that being said, our screening questions are if you have a documented temperature of 100.4 when you're visiting us, or if subjectively you tell me you had a temperature at home. So the definition is over 100.4, but in terms of testing, we're not strictly adhering to that definition.
Mm-hmm.
That make sense?
Yes. I just didn't know what you considered a person having a temperature, because everyone's body varies. So,
it is. So,
and
I mean,
also,
if you're looking for a trigger, of when do I get worried, in my mind, that is 100.4.
Okay. Thank you.
Thank you, Rose. I sure appreciate it. Again, if you have a question, it's *3. Is there another question on the line?
Our next question is from Joan Ham.
Hello. My name
Hello,
is
Joan.
Ham. Hello, my name's Ham, not Ham, but that's okay. Everybody does that. I am 80 years old, and my family has grounded me, and I'm staying home. However, I just heard today that Giant is opening their store to, they call it elderly people, from 6 in the morning to 7. Now, how good is that for a person to go get their groceries at that time?
Well, Rose, I can't necessarily. I think I ought to. This is Scott. I think I ought to take this one. I don't think that they're saying you can only go exclusively from that time. What they're saying is that they don't want you to have to compete, so to speak, with sometimes could be crowds of people coming in to get what they need, and probably they have restocked overnight, so they're trying to give you, our senior population, the first crack at what you need, understanding that oftentimes you have a limited storage capacity and you're kind of buying your groceries week by week, to give you a first opportunity to shop there before the shelves have been kind of picked over. I think that's the intent there, not to make you get up early and
No. That has nothing to do with it. And I don't care about getting up early if I go in. But the thing is, I don't think I'm any safer there than I would be if I went a different time. I mean,
I see what you're saying. Yeah.
That's what I'm saying.
Yes.
I guess it wouldn't be unless the stores has been clean and all that better than it would be later in the day. But that was my question.
That's what I was going to add. This is Lisa. I think that they can do a better, at the end of the day, they can probably do a better cleaning to get ready for that next day. So they're allowing the seniors to come in early in the morning. So you are the first ones touching any of the surfaces, so you might not be exposed as a day.
Okay. So it really isn't necessarily safe, but it might make it slightly safer, right?
We sure hope so, Joan. I mean, other than having the food delivered to your home, which some places do that, some do not, some charge do not. I think what they're trying to do is to open up access, make it as easy as possible and as safe as possible for the folks that we have determined have the greatest vulnerability. Okay?
Okay, so having this program, I appreciate it.
Thank you, Joan. We sure appreciate you calling in. Is there, again, dial *3 if you have questions. Is there another question, please?
The next question is from Donna Mann.
Hey, Donna, are you on the line?
Yes, I am. I have a question. Yes. We're due to go for my husband and I regular checkups at our WellSpan physician, and my husband had lung cancer about a year ago, and I'm wondering if it's safe to go to get our blood work done for that visit.
Dr. Gaspar, can you address that question?
Sure. I'll address it in two parts. The first one is we just made a recommendation today to our physicians to start looking at their schedules and postponing any regular checkups out 4 to 6 weeks if possible. So you might be getting a call either today or tomorrow saying if everything is going well and if you don't have any pressing questions for the doctor, could we push this out 4 weeks? So that's number one. The second one is that we've shifted from passive screening to active screening, so that not only at our hospitals and our ambulatory sites, but also outside of our labs and our imaging, we're going to have someone out there asking questions and screening every patient that comes in. That is to ensure that when you get inside our building, you should have some confidence that you're not going to be exposed to the COVID-19 virus. So to answer it is yes, you should still feel safe coming into one of our facilities now that we're doing active screening. But if the care is not absolutely necessary this time, if you feel you would be okay with pushing it out 4 to 6 weeks, I would advise doing that.
Okay. All right. Thank you very much.
Thank you. Thank you very much, Donna. Is there another question on the line, please?
Our next question is from Miss Marty Cannon.
All right. Marty, are you on the line?
I am. Thank you for taking my call.
Yes, ma'am.
I'm currently 61 years of age. I just recently recovered from a bout with cancer. I feel my immune system is probably compromised. I have a temperature of over 101 degrees. I have shortness of breath and a sore throat, and I went to my doctor, and she told me because I was not in any international country or around a person that I knew had the coronavirus, the coronavirus test was not available to me to be taken, and that I should just go home and self-isolate. So I've been self-isolating now for 3 days, but my temperature is not going down, and my throat isn't getting any less sore. So are you telling me now there are available tests that I can go take?
Right. I can answer that one. Thank you, Marty, for bringing up this question. This has gotten a little confusing because the recommendations have changed every day. When the coronavirus and when COVID-19 first came into our area, the only means we had for testing was through the Department of Health. And the PA Department of Health only had the ability to do 150 tests a day. So for a period of time, up through Saturday or Sunday, it really was rationing the tests to those that were the most sick. And those were typically people who were in the hospital, maybe on a ventilator. Those were the majority of cases that got tested. Every test that we wanted to do on a patient in our community, we had to have a one-on-one discussion with the Department of Health. As of Sunday, that all changed. So commercial testing became available, commercial testing became available, and then the indications for testing changed. So at that time, we dropped the travel piece. Not that it's not important. We still want that part of your history. But at this time, if you have a temp of 101, like you said, and shortness of breath, regardless of where you traveled, you should be able to get testing at one of these WellSpan tents. Now, that being said, you should call your PCP. Is your PCP a WellSpan PCP or not?
No, Geisinger.
Okay, it doesn't matter. I'm sure Geisinger has tents too. But either way, now the commercial testing is available. I would call your PCP and see where you could go to get tested.
Okay.
Thanks
as
so
of
much,
today,
Marty.
I
Yeah,
appreciate that, but Mr. Perry, you must understand that as of today, this morning at 9:30, that was not available to me. Okay, and I know I'm in your risk category. So you, as my representative, be aware that what you're saying on this phone call is not accurate. So I'm going to hang up now, and I'm going to go call my doctor to see if I can get a test. But I'm telling you, I was not able to get one. Okay? So you heard it from me. Thank you.
Marty, before you hang up, are you still there? Can you do me a favor and just contact our office? We have one in Dauphin County, York County, and Cumberland County. I'm going to give you the number here because I want you to contact.
I have the number. I already contacted your office. So I have the number.
When did you contact us?
I believe that was on Monday afternoon.
Okay. Can you give me an update, our office an update today after you contact your practitioner, please?
I would be happy to.
Thank you, ma'am. Yeah, we want to know what you're told, all right? So if we have to get involved, we certainly will.
Thank you. Bye-bye.
Thank you, Marty. Bye-bye. All right, is there another call? Again, dial *3 for questions.
Our next question comes from Miss Nicole Given.
Hi, Nicole. Are you on the line?
I am. Thank you.
Yes, ma'am.
Yeah, so I've been doing a lot of research. My husband and I have a church here in Hummelstown, and we're looking for clarity. We're a very small church. We're looking for clarity, some more clarity on faith-based organizations. We feel a sense of responsibility to care for our people, but we do want to respect and honor the desire for, no more than 10 gathering, and we practice social distancing. I think my question was probably answered in the first caller's answer with gardening and stuff. We want to meet outside. We want to pray. We want to pray for our community, being respectful of distance and not gathering, more than 3 or 4 per little cluster or group that go walking. But can you give some clarity as to what we can do as faith-based organizations to care for our people, but also honor, the most vulnerable as well, but also care for people that we just feel really burdened to care for?
Absolutely, Nicole, and I think that's a great thing. I'm going to start here, and then if either Lisa or Dr. Gasparek can weigh in. I think that a lot of things are possible, but you want to follow the guidelines that have been set by the federal and the state government, not only for social distancing, but also for the size of the group that you might have. And I think that at this point, generally speaking, it's that they recommend no greater than 10. That was the last that I heard, but that might have been updated. But obviously, that anytime you're together, there's an increased risk, just because it could be airborne, as Dr. Gasparek has said, or even because it might survive on surfaces or in clothing, as Lisa has said. So understand there is an increased risk anytime you get together. We do understand that people want to continue to worship and do many things in their lives, but they also have to be aware of the potential circumstances. Lisa, is there anything that I'm missing there? Go ahead.
Well, there is a resource for your church. The Centers for Disease Control, the CDC, does have some interim guidance it says, Get Your Community and Faith-Based Organizations Ready for Coronavirus 2019. So it's some interim guidance. So I would put you to the CDC website, and if you put in your search church recommendations or guidelines, I think that it would come up for you, so you'd be able to see that. So that may be of assistance to you.
Thank you.
Hey.
Dr. Gasparic, do you have anything to add to Nicole's question here?
No, I think you covered it. I just would implore you to try and explore alternative means of virtual services if possible. I know we had to miss Mass this Sunday. It did feel a little strange to do it online, but we're all trying to keep each other safe.
Yeah.
Absolutely. Thanks so much, Nicole. Thanks for the question. I'm sure other people have the same one.
Thank you.
All right. Yes, ma'am. Are there other questions? Please dial *3 if you have a question.
Our next question comes from Bill.
Hey, Bill, this is Scott. Are you on the line?
Yeah, I am. Thanks for having the call. Why, if you live in a CCRC, it seems like it's common sense here, but a continuing care community, of course, and you're in an independent living and you're watching your grandchildren, is that a big increase in risk? Because then I guess the grandparents are more at risk than the children are, but you still got kids coming and going from your cottage or wherever if you're independent living. So can you just address that a little bit?
Yeah,
sure.
Go ahead.
Go ahead. This is Lisa. Yes. Well, the one thing about COVID-19 in children is often their symptoms are very mild, and we might not even realize that they're sick, but they can transmit that to you. So that's why the restrictions are not having anyone come in, even if it's your grandkids, and you know them, because you don't know about their exposure, and if they've been with other kids anywhere, if they've been to the store with their family, that they might have been exposed, and they could be carriers of this virus to you. So that's the reason that there's restriction there a lot of places.
And Dr. Gasparic, do you want to weigh in here too? Because I suspect you probably have something to say here.
I would just reiterate what Lisa is saying, is that the COVID-19 in the younger population, it looks like a cold. But even before they develop symptoms, they could be carriers for the virus. So you could be watching your grandkids who are healthy, or maybe have a slight cough, which is normal for kids. But you could be exposing yourselves to the coronavirus, which could be devastating for anyone over 60.
Bill, that's a great question. All of us want to spend as much time as we can with our children and our grandchildren, but I think what Lisa and Dr. Gasparic are saying is there is an increased risk because children, even when they evidence symptoms, when they're manifesting those symptoms, they're very mild, and not only might the child not even say that they have a cold or don't feel well, but the parents might not know it, and so it's an increased risk that I think probably most folks would recommend you don't put yourself in. So I think that's probably the most prudent advice.
Okay, thank you very much for that question. That's a good answer, I think. With all the kids being off school, why grandparents are taking over in some cases, and that's why I asked the question. So thank you again.
I think it's a great question, and while I know that a lot of kids are off school, I don't think that that's the intention, is to have them come stay with their grandparents. I think that it's probably actually antithetical to that, but I do appreciate it because I think it's a great question and a great opportunity to inform people. Do we have another question on the line?
Our next question comes from Edward Mandel.
Okay, Edward, are you on the line?
No, this is his wife.
Okay, go ahead.
Okay.
Ma'am.
Yes, there's two of us living here, and my question is, if one of us should come down with it, is it inevitable that the other person will, or are there extra precautions that we could take?
Dr. Gasparic, can you address that?
Sure. I mean, one of the scary parts about COVID-19 is that it can affect everyone differently. So it's hard to predict if you'll respond to the virus the same way your husband does. What I would say is, practically, by time your husband would have gotten tested, he would already be symptomatic, and he was probably contagious 3-4 days before that. And then the testing itself takes 4 days. So you're probably going to be exposed to your husband for a solid week. At that point, there's really not much that you can do other than I would continue to wash your hands frequently, try not to touch your face, all the stuff we mentioned before. But I would encourage you to then isolate yourself from other people, knowing that you've been exposed to someone that is a confirmed positive test. And then you yourself should be tested if you develop symptoms.
Okay. I will do that. Thank you.
Yep.
Thank you, ma'am, and we hope you stay safe. Is there another question?
Yes, this will be our last question, and it is from Mr. Brian Factiu.
Okay, Brian, are you there?
Yes, sir. Brian Factiu. Yes, sir. How are you, sir?
I'm well. Thank you.
I had a quick question. Quick question.
Go ahead.
I'm in the medical field, and I know typically when you get an infection, you create antibodies and the such. What is the likelihood of someone being reinfected after they've already recovered from it? And is there any data out there that is indicating any kind of mutation so far?
Doc?
So you're correct, Brian. I mean, when we're exposed to viruses, that's how we develop antibodies and then can fight off the virus. That's the whole idea behind the flu shot, the flu vaccine. The problem is that these viruses get smart and then they mutate every year. So if you're infected with this current strain of COVID-19, your chance of reinfection is very low. But if this COVID-19, the same strain, were to come back around next year, there's a potential it could have mutated some, that there could be another wave in the future, just like we see with flu.
I just wanted to make sure that there's once you're exposed, you're not, you're at lower risk for getting it again, I guess.
Correct. For this
I don't believe everybody.
It's not going to be a lifetime.
Yeah, for the season. For the season, I mean.
Yeah.
Okay. Thank you for taking my question.
Well, thank you. Thank you, Brian. And I know a lot of people do have that question, and they've heard all kinds of rumors and so on and so forth. So it's good to get the facts and the truth about that. Folks, our time, unfortunately, has come to an end for this call. I want to thank Lisa from Country Meadows Retirement Communities and Dr. Gasparic from the WellSpan Medical Group very much for their attendance, for their expertise, and for their willingness to be on the call to answer some questions. I understand we were at max capacity for this call, and I apologize now for anybody that couldn't get on the call. We are going to, because of that, endeavor to have other opportunities like this for people to call in, get their questions answered, and remain safely where they are. So we will keep you posted for that. And, of course, if you do have further questions legislatively or otherwise, you can check our webpage or you can call our offices in York, Harrisburg, and Wormleysburg. A good number is 717-603-4980. And with that, I just urge you all to heed the precautions of the CDC and your practitioners and to stay safe out there. So God bless everybody and have a great day. Thank you.